There's evidence that consolidation or maintenance therapy or extended rituximab therapy after our chemotherapy, and most recently after obinutuzumab chemotherapy, can prolong the progression-free survival, the time to next treatment. And probably we're starting to see hints that it may improve survival. It still will require longer-term follow-up. But up till recently, all we knew that it's the addition of 2 years of rituximab and most recently obinutuzumab after R or G chemo can prolong the progression-free survival and the time to next treatment. And it became an option for physicians and patients to elect to get the extended course with the maintenance, or elect to just get the R chemo, G chemo, and wait until recurrence and use different regimens. These are discussions usually with the patient about the data, lack of survival advantage, at least strong survival advantage for now, and about whether they want to commit themselves for 2 additional years of treatment coming in every 2 months, disrupting their lifestyle if they're busy traveling and so forth, in exchange of delayed time for next treatment, or they want just to take a break and come back when the disease. So it's a discussion. There's really no guidance right now to who or how can you select patients for maintenance.
In 2007, when we updated the response criteria for non-Hodgkin's as well as Hodgkin's lymphoma, PET scans were still relatively in their infancy. And in those criteria, PET was considered the gold standard for response assessment, but primarily for large cell lymphoma and Hodgkin lymphoma, because those were the histologies for which we had the data. Since that time, there have been several studies clearly showing benefit using PET scans in follicular and other histologies of non-Hodgkin's lymphoma. Judy Trotman, for example, published a paper in which she took 3 studies, 2 of which were retrospective analyses, 1 was a prospective analysis of the role of PET scan in restaging of follicular lymphoma, and showed that patients who were PET negative after treatment had a significantly longer progression-free survival and, in fact, overall survival than those who were PET positive. So PET-CT scans are now, according to the Lugano classification, a standard for restaging all FDG-avid lymphomas, which includes follicular lymphoma. That's for restaging. There is not a clear role for surveillance scans once the patient is already in a complete remission, or for most patients, even a partial remission. And those should be based on clinical parameters, patient signs and symptoms of the disease.